Welcome to Connective Care Education. Learning Outcome 2: Factors that affect well-being. Social and emotional factors that can affect health, well-being and development include gender. Gender stereotypes. Even today, men and women are expected to conform to certain gender stereotypes. Women who refuse to conform are classed as being butch, whilst men who fail to conform are referred to as effeminate. Gender inequality. Women tend to live longer than men, but spend fewer years in good health. The gender pay gap puts women at greater risk of living in poverty, which would affect their well-being. Transgender. Experiences of discrimination, social exclusion, harassment and violence directly impact the health and well-being of transgender individuals. However, transitioning and being able to express gender identity improves health and well-being. Relationships. Parent and child. A relationship between parent and child needs to be consistent and sensitive in order to avoid any negative emotional impact. If children feel that they can rely on a parent for comfort when they are distressed, they will grow up feeling that they are worthy of love and care. Children with a strong emotional bond to their parents are less likely to be influenced by peer pressure in their teens. Siblings. When siblings are young, their type of relationship varies depending on age and gender. When they are young, they tend to fight in physical ways, but as they grow older, this will develop into verbal arguments. Adult siblings tend to have relationships that fall into one of the 5 following categories. Extremely devoted, placing sibling relationship above all others. Close and caring friends, but place a higher value on marriage and parent and child relationships. Loyalty based on common family history, maintain regular contact, participate in family gatherings, and are there in times of crisis. Don't really feel connected and have infrequent to no contact, hostility based on resentment and anger. Friendships. These are important for a number of reasons and can promote health and well-being through support, boosting self-esteem, keeping you active and helping you to achieve a positive approach. However, dysfunctional friendships have a negative impact on health and well-being. Friends can pressure individuals into doing things that are bad for them and can damage their self-esteem through constant criticism. Intimate and sexual relationships. This type of relationship can have a positive or negative effect on health and well-being. Individuals may tend to put on weight and take less care of their appearance once they're in a comfortable, intimate relationship. However, the opposite can happen, with couples motivating each other to keep fit and eat healthily. Healthy sexual relationships can reduce stress levels, but if one partner feels pressured into a sexual relationship, then this can cause stress and anxiety. Working relationships. Health and well-being are positively affected if an individual feels part of a community and supported by their colleagues. This develops an individual's sense of belonging and purpose and helps them to feel more in control of decisions which affect them. Adverse childhood experiences. These traumatic experiences occur before the age of 18 and are remembered through adulthood. These can include emotional abuse. This can include exposing a child to violence, modelling bad behaviour, or failing to meet a child's emotional needs. This can lead to a child developing mental health problems, eating disorders, and can lead to self-harming. Sexual abuse. Any sexual activity that a child is persuaded to take part in is classed as sexual abuse. It doesn't have to involve physical contact, and the child may not realise that it is wrong at the time. This can lead to severe mental health problems and the risk of self-harm. Physical abuse. This includes anything that would directly harm the child's physical safety. Children who are physically abused may not do well at school and could become involved in criminal behaviour and develop drug and alcohol problems. They can also suffer mental health problems. Shaking a baby can lead to serious injuries, including brain damage, hearing and visual impairments, learning problems and behavioural problems. Domestic abuse. This is an ongoing pattern of abusive, coercive and controlling behaviour involving physical, sexual, emotional and financial abuse. Children who experience domestic abuse are more likely to be part of an abusive relationship as an adult. Neglect. This is a consistent failure to meet a child's basic needs. Children who experience neglect are more likely to get involved in crime, have alcohol or drug problems, and get involved within dangerous relationships. Please pause the presentation here and complete the worksheet for Unit 003, Learning Outcome 2, Worksheet 5. Employment. Being employed is good for health and well-being. It allows individuals to have the means to develop themselves, have a sense of pride and personal achievement, to socialise and to find support, to have structure and purpose to their day, be physically and mentally active, and to have money to support themselves and their family and to explore their interests. Unemployment. According to the Royal College of Psychiatrists, individuals who are unemployed are more likely to have poorer physical and mental health overall. They'll consult their GP more often. They'll be more likely to be admitted to hospital and have higher death rates. Work-related stress. If the demands of a job are greater than the employee's ability to cope, then this can lead to work-related stress, which can also lead to anxiety and depression. Cultural and racial diversity. Culture. Culture is a set of ideas, customs and behaviours shared by a particular group of people or society. It can affect how a group of people think of health, illness and death, causes of diseases, where they seek help and the types of treatment they want. All of these things can influence health and well-being. Young people from different cultural backgrounds can feel caught between two sets of cultural standards and values due to cultural views on sexuality, relationships, gender roles, education and employment. They can feel restricted in their choice of friends, and dating can cause family conflict. Racial diversity. Race refers to an individual's race, colour, nationality and ethnic or national origins. Some races have a higher chance of certain diseases. For instance, sickle cell anemia is more prominent in Africans, Asians, Middle Eastern individuals and Eastern Europeans. Mental health issues can arise due to racism, which can lower an individual's self-esteem and confidence, which can lead to individuals withdrawing from contact with others or being afraid of going to school or work. This will increase the risk of problems such as depression, anxiety and substance misuse. Factors that may affect individuals. Economic. Economic factors that can affect health, well-being and development include wages and benefits. For adults, managing on a low income can be stressful and feeling at the bottom of the social ladder, which can have a negative effect on self-esteem. Individuals on a lower income are more likely to adopt unhealthy lifestyles such as smoking and drinking, whilst individuals on a high income are able to afford healthier lifestyles. This leads to an increased risk of heart disease, stroke, cancer and diabetes. Savings, bills and debt. Individuals in the lowest income groups are more likely to have no savings, be behind on their bills and have high levels of debt. Those high levels of debt can have a negative impact on health and well-being because individuals can end up paying back far more than they borrowed, and their repayments can mean they don't have sufficient income to take care of themselves and their family properly. Individuals can find that they have less access to financial services such as having a bank account, or they have to pay more to use these services. Families can break down because of the stress caused by debt. Health can also be affected by less access to healthy food and exercise opportunities, and illnesses brought on by stress. Mental health problems such as depression and anxiety can occur due to worries about debt. Poverty. According to the Poverty and Social Exclusion Organisation, the following groups are vulnerable to poverty: single parents on benefits, the young unemployed, low-paid workers supporting a family, adults who are disabled, and single pensioners. Poverty can negatively affect health, development, and well-being in the following ways. Poverty in adulthood. Cardiovascular disease, diabetes and arthritis are more common in adults living in poverty. Mental health problems such as depression, anxiety and schizophrenia are more common. Poverty in later adulthood. Poor individuals may develop life-limiting illnesses earlier in life than individuals with money. Pensioners in poverty are more likely to experience social isolation and mental health problems such as depression. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 2, Worksheet 6.